We've ticked over into Season 2 of Fertile Ground, and with a new season comes a new host. I'm Nick Robinson, and what a better place to kick off having a male host than with an episode on male factor infertility. I know that most of the listeners to this podcast will be women, but I'm a big believer that men are on this journey too, and it's helpful for everyone to be informed along the way. From a personal perspective, my partner and I did multiple rounds of IVF before having our son. So I know my way around this world, but I'm really here to ask the questions of Dr. Jody so we can share in her experience. So let's get started. Hi Dr. Ruba, thanks very much for joining us today.
Thank you for having me.
So because we're discussing male factors in fertility, the best place to start might be with the basics. How important exactly is the man's fertility when it comes to trying to conceive?
Oh, it's hugely important because, as we know, it takes a good egg and a good sperm to make a healthy embryo. And so the contribution from a male is 50%. So just as important as the egg.
Yeah, well, that makes sense. So how often do you think sperm is the determining factor in a couple's infertility?
I would say it's more frequent than people would think. I couldn't give you an absolute percentage, but it is certainly a significant contributing factor to infertility, and it is a growing factor worldwide. Sperm issues are becoming more significant. Sperm counts around the world are falling.
And is there a reason for that fall in fertility in men?
We can't pinpoint the exact reason for it. Perhaps it's aging, perhaps it's environmental, but we can't pinpoint the exact factors at this point in time.
So if I can get a little technical for a minute, can you run us through the terms used in a sperm test result and what they might mean for fertility?
Okay, so with a sperm or semen analysis, we require a sample, and we look at significant things like the volume of that sample. Obviously, that helps us understand if there is enough sperm in that sample by giving us numbers. So they do tell us a sperm count, a total count, and concentration, which helps us know that we need a good number of sperm to actually cross the threshold and get into the tube where fertilization occurs most of the time. So it's important to have a normal sperm count. When the scientist also looks at the sperm, they look at the appearance of the sperm. So we do know that normal looking sperm is very important, and morphologically, or the appearance of the sperm, if it's abnormal, it can affect the function of the sperm. So the head of the sperm is a region called the acrosome, and the acrosome is responsible for actually penetrating the egg to enable fertilization. So one can imagine that if that head is abnormal, that fertilization may be significantly impaired. The tail of the sperm is incredibly important because it helps it move forward. So if there are abnormalities with the tail, that could cause problems with fertilization because the sperms are unable to reach the egg. The good news is that usually a lot of these sperm problems can be overcome by the current technology we use in IVF, including the technique called ICSI, or intracytoplasmic sperm injection, which we rely heavily on when there's a significant sperm concentration or abnormal looking sperm.
So if a heterosexual couple presents with infertility concerns, do you run a sperm test straight away?
Absolutely. I think because it's 50% of the embryo, it's very important to have the results of a good semen analysis so we know exactly what factors might be playing into the couple's fertility issues. And then we may make attempts to try and improve the quality of the sperm. So we know that taking a supplement called enzyme Q10 can be helpful to improve sperm quality. Other supplements like high-dose antioxidants, lifestyle factors like cutting back on smoking or hopefully stopping smoking, reducing alcohol intake, looking at other lifestyle factors. So is this man perhaps taking anabolic steroids or steroids to increase muscle mass. That can have a negative effect on sperm, or other recreational drugs like cocaine. So we do know that being very thorough about taking a history and being very honest about what's going on in someone's life, including stress and illnesses like COVID and the flu, can significantly affect sperm, its count especially, as well as the morphology of the sperm. So it's important to understand what's happening in that person's life and whether they've recently been unwell.
So I think it's reasonable that blokes would feel reasonably anxious about doing a semen test. Can you talk us through the process and do they need to be so worried about it?
I think they don't need to worry too much. So that it can be done in the privacy of your home, as long as you can bring it to the laboratory within an hour. It needs to be kept warm. And there are some instructions that we usually give the men so they can read through them. So there's instructions like frequent ejaculation actually before you give the sample, abstinence for a few days before, trying to collect all of the sample is important, and then obviously bring it to the laboratory at the correct time is also very important. So it's not uncommon that we get incomplete specimens, but most men are very able and usually at quite short notice to be able to give us a sample.
Yes, I agree. So once that testing is done, and if the results reveal that a couple needs to go through IVF, at some point you'll obviously need sperm from the man to add to the egg to help create that embryo. So when and how does that sperm sample happen?
So if you are undergoing IVF, we do usually want a sample on the day of the egg pickup. So again, most of the men will come into our clinic and produce a sample there in one of our private rooms, and then we're able to use that fresh sample, which is the best sample to use in terms of sperm with IVF. And yes, then we're able to let them know how fertilisation goes.
I suppose this is something your team does every day, managing people's anxieties about this process.
Oh, absolutely. Our nursing staff and our scientists are fabulous and very, as you said, nurturing and I think kind and understanding that it's a really pressured environment because your other half is downstairs having their eggs collected away from you, and you feel very vulnerable at that moment, and it can be a lot of pressure. So we do understand if there's some anxiety around that.
And how can women encourage their male partners to get a sperm test if they're reluctant to do so?
So I think by explaining how important their contribution is, how important it is for us to understand how we need to modify their particular treatment if there is an issue with the sperm, or how we might be able to improve the quality or quantity of sperm before the IVF treatment gets underway, so we have a greater chance of success.
If someone was trying to improve their sperm health, how long does it take for those changes to take effect?
Generally around 3 months is how long it takes, because obviously the sperm is being created and then it's being stored for a while and then it's being used. So it does take a cycle of around over 70 days before we can see how those modifications have affected the sperm, hopefully positively.
So we know that age is a major factor for women. However, you still hear these stories of men getting women pregnant when they're in their 70s or in their 80s if you're Al Pacino. So does this mean that the man's age doesn't matter at all?
We actually know now that the man's age matters a lot, particularly over the age of 45. We know that men who father children after 45 years old may have offspring that are at increased risk of certain conditions, such as autism spectrum disorder and schizophrenia. So it does have a bigger impact than we previously gave it weight. I think that it is something to be considered. And yes, there are many successful pregnancies as men get older, but it still has an impact possibly on offspring.
Well, thank you again, Dr. Jody. It's been a really interesting chat and something that I think a lot of men might not like talking about, but it's really helpful to have the information out there. Let's wrap it up there for today.
Thank you. My pleasure.
If you've enjoyed this episode, please don't forget to subscribe to Fertile Ground.